what we've worked hard on over the last 10 or 15 years is really moving the culture of the conversation towards learning. Because as Anne says, if you collect the basket of information that informs learning at its greatest, sort of at all its levels, you'll be able to extract from that absolutely the information that you need to report effectively at any level, from an implementer to a donor, from a donor to their external stakeholders on up the chain. But I do think it's a very interesting puzzle that we're always engaging, this conversation between accountability and learning. And even though you see a lot of language now and a lot of sort of posture around the notion of learning, it's an ongoing battle to really pull folks, and managers particularly, into the learning process.
Yeah, I think that's true. And creating space within your health programs for managers to step back and look at the data that they have is also a big challenge. We do emphasize a lot of action in the field. There's always this ethos of if you're doing something, you're actually making progress. And the M&E systems need to enable those implementers to continue to make progress, but we also have to create space for them to sit back, reflect on what they've learned over the course of a month or 3 months or 6 months, and then ask themselves if the kind of strategies that they're putting into place are making progress in the direction that they hope they will do. And I think that's one of the biggest challenges. Often the M&E staff are stuck in a little room and they're crunching data, and then they put a report out, and they're not brought into that kind of decision making during the times when projects are thinking strategically about how things are going. And we spend a lot of time trying to bring program staff and M&E staff together to be part of a strategic thinking team, a learning team for each activity.
Yeah, and that's actually something else that I wanted to touch on that I feel this has led into, and it's something that Keith and I discussed yesterday, was just creating that context of learning and changing the culture of an organization. So far as that is just part of the culture, is that you're using this information to learn. And Anne, you mentioned making sure that you're always bringing people together. Are there other ways of building that culture of learning that you guys are working on?
I'll take a crack at this one, Anne, and then pass it to you. So, when we talked yesterday, Kelly, I talked about, I'm gonna take one step back on that question, if you don't mind, and then I'll circle back and answer it. And that is this notion, the question of utilization of monitoring and evaluation information. And Anne was just talking about the things that she does on the projects to really promote, integrating the monitoring and evaluation process into the broader management discussion of their projects and programs. So this is something that that we really find to be one of the biggest challenges as a monitoring evaluation provider to implementing partners and donors and different agencies. How to really focus on and bring utilization of that information right into the middle of the management process. And I think there's three things that are the constraints, and if we can address those constraints, are the solutions to better utilization. One is culture, and I think moving an organization from a traditional focus on work plan and budget and managing work plan and budget and accountability and sort of as Anne said, just getting things done and making sure that we're cranking out our work, and moving them to a place where they will take a step back and say, if we've delivered all these workshops, are we seeing improved learning? Are we seeing change behaviors as a result of that learning? Are we seeing improved coordination or collaboration, et cetera, et cetera? Getting an organization to understand that that is management, and also that failing in something is okay as long as you know that you failed and you have an idea of why. And so building systems that can embrace learning. I've often said to the folks that I work with on results-based management, I say, look, you are building a system that essentially wants to learn in the near to medium term so that you can perform in the medium to long term. Mm-hmm. And learning in the near to medium term sometimes will mean learning from success, and sometimes will mean learning from failure. So moving an organization into that space and into that kind of a culture takes time, but it's absolutely imperative if monitoring and evaluation efforts are really to essentially effectuate the kind of management that we hope to see. The second constraint, I think, has to do with frankly, the skills and aptitudes of managers. It's as we develop a more sophisticated set of monitoring and evaluation tools, as we look at mixed method approaches to what we do, as managers are faced with different types of data, different qualities of data from different sources, their ability to understand and to essentially weigh different data sets and to allow their understanding of those data to inform a set of emerging or identify the management issues and then help to inform possible options for making decisions. That set of skills and aptitude is really pretty tough. It's tough to find that in a manager who's also being asked to manage finance and work plan and personnel and 100 other things. And then the last thing I'll say is I think, and this is one of the places where we're really seeing a lot of innovation, is we need to make data and monitoring and evaluation information more easily accessible to managers. That means in the way we visually display data, in the way we present it, in the way we integrate data, perhaps with video or with narrative, but really getting to a place where we can allow managers to have better and easier access to data that are the result of very sophisticated M&E designs and methodologies. That's another piece of the puzzle that we're still working on. So I think if we move culture in the right direction, if we improve the skills and aptitudes of those managers, and we help that process along by doing a better job of basically making data digestible and accessible through data visualization, then I think that's how we really get to better use and to better programming in the end.
Yeah, it's very true. I think the health sector is a good example of where that's not quite where we are yet, because we have many different health information systems that are imposed on the team. For example, the team in a health facility, they're reporting on maternal health, they're reporting on child health, they're reporting on HIV. They might have different reporting structures and systems for each organization or each program that they're working on. They might have an integrated system that means they have to spend hours on end of their day filling in forms or entering data into computers. And it's not simple. It's actually very complicated, and it is very disheartening for a lot of health staff. So we are looking at ways to try to streamline information, to try and put information in their hands that is really what they need to make decisions, rather than creating a system that collects every element of information that is possible to collect from that health facility. So simplification and streamlining, I completely agree with you, and it's a challenge for us as health opportunities emerge and challenges emerge. It becomes more difficult to do that.